In 1966, Medi-Cal was created to provide health coverage to low-income families, children, pregnant women, and the disabled. For many years, it was considered a welfare program. And I would like to say that St. John's Well Child and Family Center is also one of the premier healthcare providers in this state. Under the leadership of CEO Jim Mangia, it remains an outstanding community partner, and I am grateful for the services it offers to the residents of this community. And of course, I highly commend him and all the medical team that manages this fine facility. Let's give them a great applause. Now, recently, under Senate Bill 75, children less than 19 years of age are eligible for full scope Medi-Cal benefit regardless of immigration status. I don't believe you heard me. Because there are people in the Assembly and the Senate that don't really understand how important it is to ensure that everyone, regardless of their immigration status, has health care. And in fact, I wish I could drag those naysayers to this community so they could see all of you right now and to see how important it is that we have health care for all. I also want to thank the Department of Health Services who are working collaboratively with the County Welfare Directors Association of California, County Human Services Agencies, Covered California, advocates, and other interested parties to identify impacted children and to provide them with the full Medi-Cal coverage benefits. The Governor's Office, if you didn't know, proposed $19.1 billion. That's a lot of zeros. $19.1 billion to our general fund for Medi-Cal. This is an increase of $1.4 billion or 8% above the estimated 2016 spending level. More than 400 hospitals and about 130,000 doctors, physicians, dentists, and other welfare providers are in the Medi-Cal program. All of these hospitals and most of those providers are also covered in Covered California. Now for us, in the 59th Assembly District, we have no hospitals. We have zero hospitals in our district. If it wasn't for the great work of the healthcare providers in here, the clinics in this community, we wouldn't have anything. So again, every healthcare provider, including St. John's, should again get a round of applause, because that's our safety net. And then finally, from a personal point, my mother is about 80 years old, or 80 years young, depending on how you want to say it. And she worked in the private sector all of her life. Planned to retire from the private sector. Like many companies during bad times, it went out of business. She lost all her health benefits. She lost the retirement. Everything just was gone. My mother has a lot of health challenges right now, a lot of life-threatening health challenges. But I am proud to say, and as a son, I am blessed to say and happy to say, if it wasn't for Medi-Cal, I would be singing a different story about my mother right now. That's why this is so important for me to be here today, so important to talk about this 50-year milestone. And again, it reminds us that we are moving in the right direction. No matter what you hear on TV, no matter what you hear from that other side, the Affordable Care Act and health care providing for everyone is the number one thing and the most important thing for disadvantaged communities like ours. But we all also know that healthcare is a continuing, evolving matter that can be costly and elusive for many people. So it is our charge to make the next 50 years and beyond better for our communities. And with institutions like St. John's with us, I'm absolutely positive that we will make that happen. Thank you very much.